I'm going to check for any crepitus or any abnormalities or bumps or lumps on your chest. So I'm going to check that. Okay, now it is all normal. Now I'm going to put my hands on your chest, and you're going to say 99, okay?
99. 99. 99.
And this is for your vibration.
99. 99. 99.
Okay, you have normal vibrations. That's good. Now I'm going to check your chest excursion. Breathe in and breathe out. Nice. Okay, that all looks normal. Now I'm going to percuss your lungs. Check to see if you have any air or any fluid stuck in your lungs, okay? Okay, on your side, and your other side. Okay, that all looks good. And now I'm going to go on the other side. I'm going to do the same thing. Now I'm going to have you scoot backwards towards me, please. Thank you. First, I'm going to inspect, just check to see everything looks normal. Okay, now I'm going to palpate your back, see if you have any lumps or bumps as well. Okay, everything is normal. Now I'm going to place my hands on your back, and it's going to be the same thing. You're going to say 99. Check your vibrations.
99.
Okay.
99. 99. 99.
Okay.
99.
Now I'm going to check your chest excursion. Breathe in, breathe out. Nice. Okay, that's good. I'm going to check your kidneys. I'm going to hit your kidneys and let me know if you feel any pain, okay?
No pain.
Okay, that's good. On the other side?
No pain.
Okay, that's good. Now I'm going to check, and measure your diaphragm. Okay, so I have my ruler. And I have my tape right here. Okay. So now I'm going to have you breathe in and hold your breath, okay? There you go. Okay, now you can breathe normally. There you go. Okay, so now I'm going to have you inhale and then immediately exhale after. Okay, nice. Okay, now you can breathe normally. All right, now I'm going to measure, and it is 4 centimeters, okay, and that is normal. Now I'm going to do the same thing on the other side, and you're going to have to inhale for me and keep your air in. Thank you. Okay, now can you breathe normally now? Okay, now you're going to inhale and then exhale all the air out. Okay. Okay. Right there, now you can breathe. I'm going to measure. It is 4 centimeters as well, and that is within normal range. Take off these tapes. Okay. So now I'm going to auscultate your lungs with my stethoscope. I'm going to hear your lungs. Check to see that there's no abnormal noises in your lungs or any wheezing or anything, okay? So now when I place my stethoscope onto your back, I'm going to have you breathe in and breathe out each time I place the stethoscope, okay? All right? Okay. Okay. And one more. Okay. All right, now we're back. We're done with your back side, and now I'm going to go to the front. And I'm going to auscultate your front side, your lungs. If you could scoot a little bit closer to me, please. Expose your chest. Thank you. Okay, and same thing. Breathe in and out. And other sides. And the other side. All right, it's all normal. Okay, now we are done with your lungs, and we're going to go to your heart. So I'm going to inspect. I'm going to see that you do not have any heaves or any of those lifts. Okay. Okay, so I'm going to place here. Okay. 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 I'm going to inspect here in your aorta and make sure that it's not abnormally pulsing. Check. Okay, everything looks normal there. And now I'm going to listen to your heart now. All right. Now this is your aortic, pneumonic. Nice. Your Erb's point. Your tricuspid has a good rate of 2, and your mitral. Everything is normal. That's good. Now I'm going to turn the bell to the other side, or I'm going to check to see that if you have any bruits in your arteries. Okay. Okay. Using my bell, aortic. Okay. Pulmonic. Erb's point. Tricuspid. Nice. And mitral. All right. Didn't hear any bruise, so that is a good sign. Okay, so now I'm going to go ahead and palpate. I'm going to palpate your anterior chest. Tell me if you feel any tenderness, okay? Any tenderness? Okay, so now I'm going to go ahead and... So there was no masses or lumps present. So now I'm going to go ahead and listen to your breath sounds. So I would clean my stethoscope, and every time I lay this on you, I'm going to have you take a deep breath, okay? Okay, and then can you lift? Okay. Okay. So the lung fields were clear on the anterior chest. Also, I've been watching your respirations. The respirations are relaxed and unlabored, and
the respirations were about 12 to 20 respirations per minute. And then now I'm going to go ahead and do your lateral field. So I'm going to have you lift your arms up for me. Okay, so I'm going to listen to the right side. You're also, whenever this touches you, take a deep breath for me, okay? Okay. I'm going to go ahead and do the same thing on this side. Okay, so the lateral lung fields are clear. So now I'm going to go ahead and go around back to the posterior side. So the posterior back is symmetric. It has symmetric bilaterally. It has elliptical shape. Its color is tan, or its color is tan with a pinkish undertone consistent with the rest of the body, and no lumps or lesions or masses are present. The skin is warm and dry. And so I'm going to go ahead and palpate your posterior chest. So tell me if any of this is tender, okay? Is that tender? Nope. Okay, so now I'm going to go ahead and assess your breath sounds on the posterior side. So take deep breaths whenever I put the stethoscope on you, okay? Okay, so the posterior chest sounds were clear to auscultation. So now I'm going to go ahead and check your costovertebral angle. So I'm going to feel down at the 12th rib. I'm going to feel the angle right here. So I'm going to go ahead and palpate or percuss, and I need you to tell me if there's any pain or tenderness. Anything? Nope. Okay. All right, so now I'm gonna go ahead and assess the heart. So first I'm going to inspect the precordium, and so the apical impulse is not visible. So I'm gonna go ahead and palpate the chest. So I'm gonna start by palpating the base of the heart. Then I'm going to go down and I'm going to palpate the left sternal border. Okay, then I'm going to palpate the apex. Okay, so palpate those, and then I'm going to go ahead and auscultate for your apical impulse. So I would clean my stethoscope. Can you? Thank you. Okay, the apical impulse is present with a plus 2 force, and normally I would count that and it would be between 60 to 100 beats per minute. It had a regular rhythm. So now I'm going to listen to the heart sounds with both the diaphragm and the bell. So I would clean my stethoscope. So I'm gonna go ahead and start. I'm gonna find the sternal notch and go down to the ridge and go to the right intercostal space, the second intercostal space, and this is the aortic valve. And I'm going to go directly over to the second left intercostal space, which is the pulmonary valve. Then I'm going to go down to the third intercostal space and listen to Erb's point. Then I'm going to go down to the lower left sternal border and listen to the mitral valve, or listen to the tricuspid valve, I'm sorry. Then I'm going to go down here and I'm going to listen to the mitral valve. Okay, and I'm going to do the same thing over again with the bell. Okay. Okay, and the S1 sound was louder at the apex and the S2 sound was louder at the base.
Just take a deep breath for me. Perfect. Okay, so now I'm gonna check for barrel chestedness, which is we want you to have a 2-to-1 ratio. So I'm gonna feel here, and then I'm gonna put my hand on like your breastbone area. Perfect, and you're 2-to-1. So you don't have barrel chest, which is good. We wouldn't expect that because you are a healthy individual and you don't smoke or anything. So now I'm gonna percuss your liver sounds in 6 different places on each lung, okay? Good. I'm noting that there's resonance here. I'm hearing resonance. Just gonna pull this up a little bit. Perfect. And then I'm gonna take a listen to them. There we go. And then when I listen to them, I'm just gonna have you take a deep breath for me. And let me know if you get dizzy or anything or you need a break, okay?
Okay.
All right, take a deep breath. Good. And one more. And another. One more. Good, and one more. Another deep breath. I'm going underneath your bra. Good. One more. Okay, and then 2 more. And last one. Perfect. I didn't hear any crackles or wheezing or anything like that, which is what we're looking for. So now I'm going to have you lay down for me. This one's this way, if you'd like. I'm just going to remove these pillows just for a minute. I'll put them back for you. All right. And I'm just going to check for JVD in your neck. So I'm going to have you look that way for a minute. Perfect. And then look my way. Good. And I can put those pillows back. I don't know to do that. All right. And I'm just going to pull this down a little bit. I'm going to listen to your heart a little bit. Is that okay right there?
Yep.
Okay. Oh, I put them in the wrong way. Okay. So the first spot I'm going to listen to is your aortic. It's just on your right side at the second intercostal space. Perfect. I'm going to use the bell side. I'm listening for murmurs. I'm not hearing any. Back to my diaphragm, and now I'm going to move to the pulmonic side, which is on the left side of your body, 2 intercostal spaces down. Perfect. Use my bell. Perfect. And then moving 1 space down to the third rib down. I'm going to listen to your herb space using my diaphragm. Perfect. And I'm going to use my bell. Perfect. No murmurs there either. I'm moving down to the 4th space. Just move this a little bit. It's going to be mid-clavicular. And this is your tricuspid space. Now I'm going to listen with my bell. Perfect. And I'm going to move down to the 5th space, which is going to be under your boob a little bit. And that's your mitral space. And I'm going to listen for a whole minute and get your apical heart rate.
Do you mean to lift my boob up?
That would be helpful.
Okay. Sorry.
And then I'm just going to listen with my bell really quick. And I got 78 for your apical heart rate. Perfect.
Palpate your skin and your lung, your chest, I'm sorry. So I'm going to do something called excursion. And I'm going to put my hands on your chest and I'm going to have you take a deep breath for me. And, okay, let it out. I'm going to do the same thing in the back. Okay. And take take a deep breath. Okay, and that's equal. The next thing I'm going to do something called fremitus. So I'm going to go under your shirt here, and I want you to say 99. I'm going to push pretty firmly. 99.
99.
Okay. 99.
99.
Okay. 99.
99.
Okay, and I can feel the resonance of the vibrations on my hands when you're saying the 90, 99. The next thing is, just let me think. Oh, okay, the next thing I'm going to do is I'm going to listen to your breath sounds, and I'm going to be listening. This area here is the bronchial sounds. Then you move out a little bit. Those are bronchiovesicular sounds. And then when I get out toward the lateral, those are the vesicular sounds. And so I'm going to listen for those now and see if I can hear them. I'm not going to put my stethoscope in my ears because I can't hear them. So, okay, so I'm going to start just above the clavicle, and I am listening at the bronchial sounds. Bronchial sounds. Bronchial. Okay, we're moving out a little bit to bronchiovesicular. 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 And then to the lateral, that would be, and under the bra, would be the vesicular breath sounds. Okay? Deep breath. Good. Okay. And did I ask you if you have a cough?
No, I don't have a cough.
Okay. Or any pain?
No pain.
Okay. Remember. Okay. So in the back, I'm going to auscultate back here. I'm going to stay between the scapula. Okay. Deep breath. Okay. Deep breath. One more. One more. Okay, and then I can go under the scapula. Deep breath. And deep breath. And I don't hear any adventitious breath sounds. Nothing. No.
Listen to your lung sounds in your back. Have you had any shortness of breath or coughing? No. Okay. Just go ahead and take deep breaths when I place my stethoscope on your back. In. Out. I'm going to do the same thing to the front. Deep breaths. Okay, lung sounds were clear, and I'm just going to take a listen to your heart, starting at your aorta. Pulmonic point. Erbs point. Tricuspid. And mitral. I'm going to listen to that for 1 minute. Okay, it's been 1 minute.
So, would you mind lifting up your shirt for me?
Oh.
Okay, lift up your shirt for me, please. Alright, so we're going to listen to the aortic with the bell. Not the bell. The diaphragm. We're going to listen to the aortic, the pulmonary, Erbs point, tricuspid, and the mitral, which is going to be at the apex of the heart. And now with the bell, we're going to listen for any extra sounds, heart murmurs, anything like that. All right. And we're going to go ahead and we're just going to go ahead and do your lungs, okay?
right, so there's 10 spots on the front. He's looked in my room. All right, and we're gonna go ahead and do your back. So you can just get comfortable whenever you want to do that. Oh, here, you can turn right here. All right, and there's actually 18 points on the back.
Oh, I sunk.
All right, so if you'll go ahead and stand for me.